Hello, good morning. Are you the mother of Juana Mukatkat?
Yes, I'm Juan's mother.
Hi, I'm Dr. Taylaran. We have just ruled out your son's diagnosis. Your son is sick because he has malaria. Malaria is a disease that is caused by a protozoan parasite called Plasmodium. Plasmodium enters the human body through the bite of a female Anopheles mosquito. In the case of your son, he is infected specifically by the species Plasmodium vivax, which is the most widespread type of human malaria, affecting 2.5 billion people worldwide. According to the World Health Organization Global Malaria Report, there are an estimated 1.7 million cases since 2019, specifically rampant in Pacific regions including the Philippines, with 6,120 cases and 3 deaths in 2020. The symptoms your son has presented, such as fever and chills, headache, muscle pain, nausea and vomiting, appetite loss, and joint pain, are all congruent to that of malaria. He had very high fever as we checked a while ago, and we have also noted from you that before today, he had fever just 3 days ago. This is a common characteristic of Plasmodium vivax malaria, which is called tertian fever pattern. This means that the patient's fever occurs at an interval of 2 to 3 days after the 48-hour blood stage phase of the infection. This is caused by the cyclic lysis of red blood cells that occurs as the active feeding stage of Plasmodium vivax, called trophozoites, complete their cycle in blood every 2 to 3 days. To confirm the presence of microorganisms, we have performed the most common diagnostic tests by taking a drop of the patient's blood and spreading it out as a blood smear on a microscope slide. Prior to examination, the specimen is stained with the Giemsa stain to give the parasites a distinctive appearance. Malaria may also be transmitted through congenitally acquired disease, blood transfusion, sharing of contaminated needles, and organ transplantation, but these happen very rarely and not in your son's case. Lastly, I have to warn you that dormant stages of Plasmodium vivax, called the hypnozoid stages, may occur in the human liver and can activate and invade the bloodstream, which causes a relapse several months or years after this infection.
Oh dear, please tell me it is treatable.
Not to worry, ma'am. Luckily, your son is still in the early stages of infection. Malaria can be treated by prescription drugs according to the severity or type of parasite your son has. Since you live in an area still sensitive to chloroquine phosphate can be used to treat the infection. Atavacone proguanil may also be used to treat and prevent malaria, in addition to an antibiotic such as doxycycline. I'm glad to say that all of these drugs are readily available.
Thank goodness. Please do everything you can, doctor. In the meantime, I think it's best if I eliminate breeding places of mosquitoes at our home. I can't have my other children and family members catch this disease.
Certainly, ma'am. Eliminating possible breeding grounds of mosquitoes, such as stagnant water, is a very good form of prevention. Though the use of insecticide-treated traps or bed nets, the application of insect repellent lotion, or wearing of long-sleeve shirts and long pants may also help avoid mosquito bites. And as mentioned, therapeutic drugs like atavacone proguanil may be used as preventive treatment for this disease. It requires only a weekly dosage, though the patient must be monitored for serious side effects.
Oh yes, of course. I'll certainly take note of that, doctor. Thank you so much for all of your advice. I'm just so relieved that we now know my son's diagnosis and that he will already be treated accordingly. Thank you so much for your help. I just hope he'll recover soon.
You are most welcome, ma'am. We will do our absolute best in treating your son. You can trust that he is in good hands.